Okay, thank you very much for inviting me to this. I'd like to hopefully share my experience as a physiotherapist and how our rehabilitation can help your patients. Okay, so with the lateral ankle sprain, we know that 90% of them are lateral and 70% of them will be the anterior talar fibular ligament and 20% the calcaneal fibular ligament. So the acute ankle sprain that we see that shows up in the clinic will show up like this to me, usually within 3 to 4 days after they've sprained their ankle. You will see a complete rupture of the ligament, marked swelling, hemorrhaging, and point tenderness, loss of significant function, decreased ankle range of motion, and there'll be instability of the joint with positive anterior drawer and talar tilt test. The standard of care is non-functional treatment or surgery. And hopefully the Ottawa ankle rules have been applied. If not, I will do that and refer them off for an x-ray if needed to rule out a fracture. So if we look at some of the literature, the Cochrane review done in 2007 looked at 2,500 young male athletes and compared surgical versus conservative treatment. And the outcomes were return to sport, sprain reoccurrence, and long-term pain and instability. And what they found is that there was not enough evidence in the RCTs to prove that acute surgery was better result than non-op. If you looked at a study in 2010, which again compared surgery followed by cast for 6 weeks and functional treatment, again, they showed that there was no difference in the ankle score and in the anterior drawer and tilt test as measured by stress radiography. And they also showed that grade 2 osteoarthritis was detected in the MRI was higher in the surgically treated patients than when compared to the functional patients. Also, in 2018, a diagnosis and treatment of prevention of ankle sprain update of an evidence-based clinical guidelines looked at 194 articles between January 2009 and September 2016. And this showed, their conclusion was that surgery was beneficial for chronic instabilities and those people who had poor response to comprehensive exercise-based physiotherapy program. But they said that surgery had longer recovery time, increased ankle stiffness, impaired ankle mobility, increased complication. And so their recommendation was functional treatment is still the preferred method as not all patients will require surgery. So what is functional treatment? How do we do this? There's 3 different phases, and I'm going to go through each one. The acute protected motion phase, that's week 1 to 4. We need to calm it down and get it moving. Usually the patients are weight bearing as tolerated. External supports may be needed, like a boot walker or a lace-up ankle brace. If they're in a boot walker, we usually try not to let them be in a boot walker for longer than 10 days. And that's what research has shown is most beneficial. Manual therapy to improve joint mobility. And we use ice and compression to try to decrease their pain so they can use less meds and increase their weight bearing. The second, also during this phase, we start exercises. Research has shown that starting early initiation of exercise during in the program following a lateral ankle sprain will lead to decreased prevalence of recurrent injuries and perceived functional instability. So ankle range of motion exercises, active range of motion exercises are started, followed by progressive resisted exercises, weight-bearing exercises as tolerated, and early proprioceptive exercises. We then progress to the progressive loading sensorimotor training phase, usually week 5 to 8 or longer. During this stage, they are fully weight-bearing, have very little pain with weight-bearing, very little swelling. So our main goal here is to try to make sure that we restore all normal movement in the talar curl and subtalar joint, and we do this with non-weight bearing and weight bearing mobilizations. A lot of times we'll see that they'll have full weight bearing, full ankle dorsiflexion non-weight bearing, but they won't have full dorsiflexion in weight bearing. So we do a lot of weight bearing mobilizations to regain that dorsiflexion in weight bearing. We also start proprioceptive and neuromuscular exercises. This is where the fun starts, and we get patients doing lots of weight-bearing exercises with single leg balance exercises on unstable surfaces to improve mobility, strength, coordination, and postural control. Also, a lot of strengthening exercises. We utilize the shuttle a lot in the clinic with the wobble board on the shuttle, single heel raises, and you can do a lot of jumping on the shuttle as well. From 8-week onwards, we start doing sport-specific training. And this is where we would look at what the individual sport here. These pictures are a soccer player. And so they're on the wobble board and different balancing surfaces trying to dribble the soccer ball with the other foot. But you can do the same thing with a field hockey player, trying to use their stick in the other hand as they are balancing on one foot. So what we try to do in this stage is break down what the athlete's sport is into different components. So a field hockey player would need a lot of running, a lot of agility, a lot of ladder work, and single leg activities to help restore their ability to return to sport. So normally we would see them return at about the 12 to 16 week mark following a lateral ankle sprain. And this quote is just basically from an article in 2017 that said that all surgeons agree that non-surgical treatment should be advised before considering surgery in patients with chronic ankle instability. A minimum period of 3 to 6 months of physiotherapy supervised rehabilitation consisting of strengthening exercises of the active ankle stabilizers of the ankle and proprioceptive training is recommended. So with this Division I ankle sprain, it was said it was the first game of her season. So she will be
30 seconds. 30
yeah,
seconds.
she will. Yeah, I just want to close that. Give the non-op a chance because she's going to miss her season either way with surgery or non-op surgery. With surgery, she may be able to get back. With non-op, she may be able to get back to the playoffs. Either way, she'll be back for the following season. Thank you.